Okay, well, welcome everyone to our webinar this afternoon. Glad to see you all here. Glad to see you joining us. Our webinar today is September is Fall Prevention Month. What can you do to prevent falls? So welcome. So glad you could make us. Our presenters today are Christiane Lau, Kristen Dorsey, and Melissa Donegan. Our webinar today is being captioned, and so please, if you need to have the captioning available to you on your screen, if you go down to the right side, bottom right hand of your screen, you'll see CC live transcript, and you click on that and you'll have access to the captioning that's going on for us. Also, if you need ACV REP credits, there will be information in the chat that I will be putting in there, a link for you to go and put in your information and apply for those credits. And then once you go through and apply for your credits, you should get your certificate within about a week or so. Okay, and our opening code for today is prevention. Our opening code for today is prevention. So make sure that you have that down if you're going to be applying for ACV REP credits. And I will give the closing code towards the end once we're all ready, gone through, and our presenters have finished up. They're giving us their important information. Also, if you are going to input any questions into the chat box, please make sure that the to portion of your chat box is set to all panelists and attendees, so that the panelists and everybody else can see your questions. Throughout the webinar, I will be giving the questions to our presenters when they're ready to take questions. So please feel free to enter your questions in the chat. The webinar is being recorded, and I will provide a link where you can access the recording in about 2 weeks. It'll be up there for you. And also make sure and visit the APH Connect Center if you are looking for more events like this one at aphconnectcenter.org/events. You can also share any events that you know of in your community on that calendar. It is, the calendar is meant for everyone in the field. We want to make sure everybody knows what's going on out there. Also, if you have any questions or need any help, we have a 1-800 phone number that you can call for our information and referral line. And the phone number is 1-800-232-5463. And again, this information I will be sure to enter into our chat so that you all have access to the links. So now that I've gone through all that stuff, let's take a poll and see who is here with us today. I'm going to launch the poll, and let's see. The first question is, what is your job title? Are you a teacher of students with visual impairments? Are you a low vision specialist, orientation mobility specialist, vision rehab specialist, therapist, or teacher, an assistive technology specialist, college faculty or state administration, a student in a college program, a parent or other? Our second question is, where are you from? The Northeast, the Southeast, the Northwest, the Southwest, the Midwest, Alaska, Hawaii, US territory, Canada, a European country, or other. And if your area is not listed, then please enter it in the chat. We'd love to recognize you. Our third question is, how did you hear about this webinar? Through APH website, email from APH, university faculty, social media, ACV REP website, a friend or colleague, or other. And then, of course, we want to know what your connection is to the low vision community. Are you yourself, do you have low vision or impaired vision? Are you a caregiver of someone who has low vision or vision impairment? Or are you a professional who works with people who have low vision or vision impairment? So I'll give us another few seconds so that everybody who wants to participate can participate. And looks like people are still entering. All right. And I'm going to end the poll and let's share the results. Okay, so let's see. We have about 12% TVIs, about 9% low vision, 44% O&Ms, 21% vision rehab specialists, therapists, or teachers. We have about 12% assistive technology, 6% faculty. So that's great. We in the chat, we see other adult non-student or non-instructor teacher who has low vision. Okay, thanks for including that in there, Brent Pike, thank you. And then we also have 26% other, so additional people there. We have about 15% from the Northeast, 32% from the Southeast US, 3% from the Northwest US, 18% from the Southwest US, 26% from the Midwest US, and then we have 3% from a European country, and then 3% from other. How did you find out about this or hear about the webinar? Our website at APH, emails from APH, 71%. So our emails are definitely getting out there. Social media, about 3%, 6% from our ACVREP website, 9% from a friend or colleague. And then what is your connection to the low vision community? So we have about 18% have low vision or have impaired vision themselves. About 6% are the caregiver of someone who has low vision or vision impairment, and 82% are professionals who work with people who have low vision or vision impairment. So that's really cool. So glad that you all could join us. We're really excited to have you, and you're ready to learn a lot of useful and really great information. So I'm going to be quiet now, and I'm going to hand this over to Pris, so Pris can get us going.
Thanks, Alaya. This is great to have so many interesting people on our conference today. So I'm really excited about having this webinar because September is Fall Prevention Month, and it's really critical that we get information out to people about how to prevent falls, because people with visual impairment are particularly at risk, and people need to know about the types of fall prevention programs that are available throughout the country for them. So we have a great group of presenters here with us today. I've had the opportunity to hear at least one of them speak at a couple of conferences in earlier years, and I'm so glad that Christiane Law was able to join us today. Christy is the Senior Director of Partners in Care Foundation's Community Wellness Department. She began her career at Partners in 2016, and she currently directs all grant activities related to the organization's statewide fall prevention initiative that's funded by the Administration for Community Living. She also manages the activities of the statewide California Healthier Living Coalition and serves as a lead trainer for the Matter of Balance program. And she has a Master's of Science in Social Work from Columbia. We also have Melissa Donegan, LSW, who is the Assistant Director for the Healthy Living Center of Excellence at Elder Services of the Merrimack Valley. She assists in the overall management and dissemination of healthy living evidence-based programs in clinical and community settings across the state of Massachusetts. She's also the National Director of the Healthy Ideas program. She began her career at the Healthy Living Center in 2004 and has been involved with evidence-based programs since 2011. Healthy living is a passion for Melissa, both personally and professionally. I know that she has been involved in the services in Massachusetts with the Commission for the Blind and working on a Matter of Balance, and she's going to be talking about that later. We also have Kirsten Dorsey, who's an occupational therapist and is the program manager for a Matter of Balance. She joined Maine Health in May of 2020 and has been developing and implementing the virtual translation of the Matter of Balance program. Kirsten has experience working with older adults in clinical and home settings, and she has seen the devastating effects of falls for many people. She's very excited to be working with Maine Health's Partnerships for Healthy Living to be providing evidence-based programs to prevent falls for community-dwelling adults. She lives in Maine with her husband and their family, and with her cats and 2 cats and 1 dog. So now I'm going to turn the program over to Christy, who's going to start us off. So Christy, take it away.
Thank you so much, Pris, and thank you for inviting us. It's so wonderful to be here with you all, and let us be perhaps the first, maybe not the first, to wish you all a happy Fall Prevention Awareness Month. We're really excited to share about this topic of falls and what you can do to prevent falls. So again, thank you so much to APH for having us and for all of you for joining. So let us start by doing a little bit of level setting about falls and what we know about falls. So just sharing a few facts here. So 1/2 to 2/3 of falls occur around the home, that area where we are around so frequently these days, right? A majority of falls occur doing pretty routine activities, so going about our daily lives. And falls usually are not caused by just one issue. It's a combination of things coming together. So certainly vision impairment is one of those things that is a key contributor to falls. As we know, vision impairment can, decrease the confidence in your next step or your ability to go about your activities of daily living, and really can contribute toward perhaps a misstep or a fall. But there are other factors that are at hand, including things like muscle weakness, medication. Other things not listed here could include, nutrition, mentation, sleep. All of those things can contribute. But the good news that we want to share with you all today is that a large portion of falls are preventable, and we will be sharing some tactics for preventing falls today. But we want to hear a little bit more from you all. In the chat box, we wanted to see if you could write one of the biggest falls issues that you feel older adults face in their daily lives. One of the biggest falls issues that older adults face. I see the injury and associated pain. Yeah, forget embarrassment, right? Broken bones. What else do we have? One of the biggest falls issues, loss of independence, improper shoes and inserts. Yes. We'll take a few more. Broken bones, hips, subsequent hospitalization, animals, fear of future falling. Absolutely. Balance issues. Yes. Rugs. Yep. Those loose rugs. Lighting issues. Yep, we'll take a couple more. All right. Well, we'll leave it right there. Stairs. Yep, that's another one that came in. Stairs. Loss of confidence. Hikes in the woods leading to falls if the path is lumpy, right? Or any change in terrain. Yeah. Those yellow wet floor signs. Yep. That's a warning. Absolutely. These are all great things. Weakness in upper legs and inability to lift their leg up. Absolutely. Rugs, what to do if they're hurt. Yes. Thank you guys so much. Neuropathy, great contributions here. Yes, all of these things are absolutely some key contributors to falls. Yes, I still see lots come in contrast, lack of depth perception, low contrast. Yes, absolutely. Injury, head injury. Thank you guys. Thank you so much. Yeah, these are all some really key issues, right, that we see in our everyday lives, whether they're, within our own circle, those we care for, ourselves even, or in our communities. And some of you mentioned that fear of falling, right? That loss of confidence. And we do know, that fear of falling can be a key contributor to falls, or even, living perhaps a more sedentary lifestyle. Some of you guys also mentioned, leg weakness or not being able to lift your leg or not being able to move, and that being a contributor to falls. So what we know is it is absolutely reasonable to be concerned about falls because safety is important, right? Not just for older adults, for everybody. A third to 1/2 of older adults acknowledge that they do have indeed a fear of falling. And how can that fear of falling impact our lives? Like you all have mentioned in the comments, that fear of falling is associated with decreased satisfaction with life, increased frailty, perhaps depression, or decreased mobility and social activity. And that fear of falling is absolutely a risk factor for falls. But we said we were going to share some good news with you guys, right? So we wanted to let you all know that the majority of falls indeed are preventable, and there are some things that you can do. We want to share a very special program or set of programs with you all today that tell you, what you perhaps may be able to do to prevent falls. Today, we're going to talk about exploring the value of evidence-based fall prevention programs. Now, what do I mean when I say evidence-based? You all might be able to recall a time, perhaps when you were in school, maybe they asked you to write a paper and they said, show the evidence, right? So perhaps, you looked up an article, or, you looked for a study that was done. And that's very much like the evidence base that backs these programs. So the programs that we are going to talk about today, including a key program, Matter of Balance, that Kristen's here to talk about, are all evidence-based, which means they're supported by extensive research. They have measurable outcomes to achieve very specific goals. They're clear, they're structured, and they're detailed. They're peer-reviewed and endorsed by a federal agency, and they can be replicated in many settings, meaning that the way these programs look here in California should be pretty much the way they look in Massachusetts or Maine or every other area in between. And there are programs for everybody along the continuum of risk for falls. So we're going to talk about programs for individuals at high risk, at moderate risk, or at increasing risk. Those have been broken down by the Administration for Community Living, and that's the source that we have looked at when breaking down the programs for those in each of the categories. So the programs that you might hear about for individuals at high risk for falls can include Capable, Otago, Falls Talk, and Fallscape. Programs for individuals at increasing risk for falls include A Matter of Balance, which we will highlight today, Enhanced Fitness, Fit and Strong, and Stepping On. And for those at lower risk of falls, individuals might engage in programs like Bingo Size, Healthy Steps for Older Adults, Healthy Steps in Motion, Stay Active and Independent for Life, otherwise known as SAIL, Tai Chi for Arthritis, Tai Chi Prime, Tai Chi Quan Moving for Better Balance, lots of Tai Chi programs, and YMCA Moving for Better Balance. So as you can see across the last 3 slides that I covered, there are a multitude of programs for anybody along the continuum of falls risk. But today we're going to highlight A Matter of Balance, and today we have Kirsten Dorsey here from Maine Health. I'm going to turn it over to Kirsten to talk to us about Matter of Balance.
Thank you, Christy, and thank you everyone for joining today. I did see there are some questions in the chat. I don't know if this is, do we want to stop and take some questions before we move on?
Sure, we can do that.
Okay.
Are you also sharing your screen with the PowerPoint? I wasn't sure if you were or not. Okay, because I didn't see it, but it could be because I have too many windows open and I'm not sure which one it is. Okay, so one of the questions that I see right now is from Fabiana Perla, and it's, are these programs developed specifically for those with VI?
I'll take that one, I guess. No, I don't believe they are. I think that these, at least for a matter of balance program, it has been a translation has been developed for people who have low vision, but this wasn't a program developed specifically for folks who have low vision.
Okay, let's see if I see any other, no, so far, that's the only question other than there was a question that came in about how participants can unmute themselves, and you can't unmute yourself. You need to, your questions need to be put into the chat. Okay, well, that's the only question so far.
Okay, excellent. I just didn't want to get too far ahead.
Yeah.
Someone had a question about the previous material. So, okay, so I'm the program manager for A Matter of Balance. I'm here in Maine, and I'll talk for a little bit about the Matter of Balance program in general, and then a little bit about the low vision translation that we've created. So A Matter of Balance is a cognitive restructuring program that reduces the fear of falling, and it increases activity levels for community dwelling older adults. And A Matter of Balance is an evidence-based falls prevention program, as Christy stated before. And I wanted to talk a little bit about cognitive restructuring. What we mean by that is we help participants in our program change their thinking about falls, from focusing on negative thoughts about falls that result in limiting their participation in activities. We try to switch that over to focusing on more positive thoughts, on strategies to be able to do activities that are meaningful. And as Christy stated earlier, we know that the fear of falling is a really big risk factor for falls, because that fear often tells us to stop doing activities, which leads to the loss of mobility skills, strength, and balance skills. And next slide, Chris. So on this slide, I have listed some of our participant outcomes. The outcomes are that 97% of our participants are more comfortable talking about their fear of falling. 97% feel comfortable increasing their activity levels. 99% of our program participants plan to continue exercising after the Matter of Balance sessions are over. And 98% of our participants would recommend A Matter of Balance to someone else, either a family member or friend. I just saw that the sound quality is not so good. Are you guys having trouble hearing me?
No, I'm
rather echoey, but I think it's your headset. And I see you're on this, so.
Okay. Well, I'm sorry to hear that.
No, that's okay.
Okay. So I did want to read a couple of quotes that people have said about our program after participating. Someone had said that A Matter of Balance was most helpful. It made me more aware of what can be done to ensure safety at home. The class provided a definite time each week to meet and discuss concerns with others. And they said that they wish they had even more exercise activities at each class. And someone else stated that they talked about being positive and focusing about not falling. And the more that you relax, the less likely you are to fall. And the last quote I have says, "It's motivated me to work more on my physical health, and thanks for the help." And next slide, Chrissy. So who should attend our programs for Matter of Balance? Anyone who is concerned about falls. Anyone who's interested in improving their balance, flexibility, and strength. Anyone who's fallen in the past would be a good candidate to attend Matter of Balance sessions. And anyone who has started to restrict their activity due to the fear of falling. And next slide. So Matter of Balance is held over 8 two-hour sessions. And during those sessions, the participants really rely on each other. people who come to our groups support one another and help each other. Groups are small. There are about 8 to 12 participants in each session of Matter of Balance. And we keep those groups small so that there's the opportunity and space for dialogue, questions, and problem solving. So during those sessions, participants learn to view falls as controllable. They set goals for increasing their activity. They make changes to reduce their falls at home. And they do participate in exercises to increase strength and balance. And next slide. So this slide begins some information on the low vision translation. It was created in 2012, and the low vision translation is available to all master trainers who are trained in the Matter of Balance program. The translation materials are located right on our resource website for all of our master trainers. And participants of the Matter of Balance program have access to the tools and materials to support their vision ability through participating in the Matter of Balance class. So some of the things that we have done to help make the materials more accessible are we have the participant workbooks in 12-point and 20-point font. We have created an audio CD of the exercises and of the participant workbook. We provide a leader training, and that also has a test for competency in implementing the low vision materials. And we've also created an instruction sheet for playing DVDs, which we incorporate into our programming that help the leaders of the program to stop and start that DVD and provide sort of verbal instructions on the different segments where they will verbally introduce speakers that maybe have a text on the screen rather than a verbal introduction, just to help make it more accessible to the folks in the room. And also that instruction sheet includes kind of a review of the segment content and visual text that's included. Next slide. So I think I already said this, but you do have to be someone who's already trained in the Matter of Balance program to access those low vision materials. And then if you have questions about how to find a class or how to become trained in the Matter of Balance program so you can implement that in your area, you would just want to contact me and I'd be happy to help you get the materials that you need. And I think that's the last slide of my section. And from here, I'm going to hand it over to Melissa Donegan. And she is the Assistant Director at the Healthy Living Center of Excellence here right by me in Massachusetts. So.
Yeah, thank you, Kirsten. Okay, so I did see a question in here from Maria where the program's located, and I'm actually going to be covering that. So we will just, I'll go ahead and get started, and that will answer that question. So thank you. I'm so pleased to be here today. So I'm going to chat with you a little bit about the Matter of Balance and how we have implemented the low vision translation here in Massachusetts. It takes a village, so we're never looking to recreate the wheel, and we're always wanting to partner with other organizations in the community who serve diverse populations. So here we partnered with the Massachusetts Commission for the Blind, the Perkins School for the Blind, and also the Massachusetts Department of Public Health. So they really helped us with resources, and they helped us with a lot of outreach. How we marketed and sort of registered folks for these low vision Matter of Balance groups through the Massachusetts Commission for the Blind. There's a pretty robust list of low vision support groups that happen across the state. So I would go and present at a lot of them about a Matter of Balance and other programs that are available to older adults and adults with vision loss. and just sort of, see what the group was interested in. And we also have other folks in the state that are trained in the low vision adaptation. So they would go out and speak with support groups as well. But that was really sort of the niche, the way that we really found that we could bring these programs to those older adults. Oftentimes those low vision support groups were held at senior centers or councils on aging or other community centers. And they would then allow us to utilize space there to hold the workshop, which was great. The participants already knew how to get there and knew how to navigate getting in and out. So it was really, really a great partnership to have. What was also nice about going to these support groups or meeting these folks ahead of time is they could let us know what supports they needed. So Kirsten did just review some of the adaptations that were made for the low vision participants. So we were able to ask each participant, what do you need from the coaches so you are successful and really can enjoy this program and we're meeting your needs? So we would really do an assessment of that to make sure that we had all of those materials and all of those supports available to the participants from day one for the workshop. So again, we would use large font workbooks, 20 font, the audio CDs that Kirsten just discussed, and also Braille workbooks. So through our partnership with Perkins School for Blind, we were able to have Braille participant workbooks made up, and we were able to have those made available as well. All right, Christy, next slide. And I think you're going to jump back in and talk about the translation in California quick.
Yep, absolutely. So just jumping in for one slide here to talk about what we've done here in California to implement the low vision adaptation of A Matter of Balance. So partnerships, like Melissa said, are so key to being able to reach a multitude of audiences. Here in Los Angeles, California, we have partnered with the Braille Institute in the past to offer Matter of Balance workshops. And again, using them as a resource to, follow some best practices too, to make sure that we are meeting the participants where they are. Like Melissa mentioned, in Massachusetts, here in California, we also used the large font workbooks, audio CDs, and Braille workbooks are available to all participants. So we might be doing a class for vision impaired, we might be doing a regular class, but just in general, we like to tell our participants that, hey, we do have, large font workbooks available, because somebody might not raise their hand and say, hey, I need this, right? But it might make their lives a little bit easier if we know that it's accessible. Like Kirsten mentioned, in order to offer A Matter of Balance, and I know that Melissa will get into this a little bit more in this presentation, in order to offer A Matter of Balance, coaches need to be trained, and they also need to be updated. They go to an update training every year. And here in California, what we've done in those update trainings is to provide the exercises from the low vision translation to all of our coaches, not just, because they might be doing classes for a vision impaired audience, but because that low vision translation includes some additional cues. They're more descriptive of certain movements that we might do with the exercises that could help all audiences who might not be able to adapt to a just follow me type of model, but who might use, some of those auditory cues to let them know what to do when it comes to those exercises. So it's just a nice tool for them to have in their back pocket that we feel it could be useful to not only meeting the participants, but to also keeping, what we call the fidelity, the rules, the guidelines of the program intact when it comes to doing those exercises and doing them safely. So handing this back to Melissa.
Great, thank you, Christy. Okay, so this will address the question before, are these happening near me? And the answer is yes. Matter of Balance is one of the most popular programs, especially the falls prevention program, I know here in Massachusetts, but also across the United States. So there are a variety of ways to find out if matter of balance or any evidence-based programs are being done in your state. So each state has what's called a state falls prevention coalition, and you can access a list of this. So NCOA is the National Council on Aging, and they're really sort of like the technical assistance center for all of this work that Christy and Kirsten and I do with evidence-based programming. So on their website, you can even just search State Falls Prevention Coalition. A whole list for you will pop up, and it's broken down by state, and it has who the contact people are and where they work and how to reach out to them. So it's very, very easy to access. And I really think that that is the best place for you to start, is by emailing them to say, I'm interested in learning more about the falls prevention programs in the state. You know, how can you help me? I know here in Massachusetts, they would answer that and then also link them up with me at the Healthy Living Center, because we provide, you know, sort of the hub here. So that's sort of how that would work. Also, NCOA has a lot of resources listed on their website for all programs that have accessibility adaptations. So I know there was a question before asking, were these programs sort of designed with vision impairment in mind? And no. However, lots of these programs, you know, are developed, and then we do adaptations from there. So we translate them into other languages. We adapt them for the low vision population or the hard of hearing population. We've even adapted some programs so they fit into workplace wellness, so they can be done, you know, during an employee's lunchtime. So there's all different ways that these programs can be adapted. But Christy just pointed out fidelity, and that's why, again, with these programs being evidence-based, we cannot just say, oh, okay, this is how we think it would work for that population. It really needs to be done in, you know, a pilot situation where we can really control the different factors and make sure, you know, that population, the way that we're sort of tweaking and adapting things, that you're still going to reap the same benefits of the, you know, original way that the program was put together. All right, Christy, next slide, please. So there are other programs that have adaptations. So again, you can refer to ncoa.org, and that will have a pretty comprehensive list. And I know Chris has mentioned a lot of things are going to be sent out and uploaded onto the website that you'll be able to access all of that. So in addition to A Matter of Balance that lives up in Maine, the Self-Management Resource Center that lives in California has another very robust suite of programs. They have programs for chronic disease, diabetes, chronic pain, cancer survivors, HIV and AIDS individuals, and a lot of their programs are adapted into many, many languages. They also have translations into Spanish that are culturally appropriate and have some differences in there. So some, for instance, with the chronic disease suite of programs, some of the ways that we would serve older adults and adults with vision losses, you know, again, we'll ask them, do you need any adaptations? So we can, in these programs and in A Matter of Balance, we have what we call flip charts. So there's flip charts that we show with information, and it helps guide conversation, and it's a nice visual for the participants to kind of know where the conversation's going. So some of the programs, they have certain charts that are posted up each week, and that can be, of course, really hard to see. So we can print those out for individuals so they could have those right in front of them. Again, so, you know, we ask folks when they're registering for the program, what's going to be most helpful for them during the program to feel comfortable and be successful and be able to participate. So again, do they need to sit close to the leaders? Is that helpful in case they need any assistance? you know, asking everyone before they begin speaking to introduce themselves so the person knows who's speaking, things like that. And then other programs, you know, will make adaptations. Again, there's that list that you can access of all of the programs that are evidence-based that currently have some kind of adaptation. So, but, you know, the great part is that, you know, Christy mentioned, it's not, I know in Massachusetts, we have specifically just worked with these support groups, and that's sort of how our low vision work has, you know, grown. However, of course, we have participants that come with different disabilities, or maybe, you know, that are hard of hearing or have low vision that, you know, they might not be identified because we didn't meet them in a group, but they might end up. So we're always wanting to make sure that people feel comfortable letting us know what they need from us, and that they know what adaptations and, you know, what things that we can give them to participate in the program. So I think that was our last slide. Yes.
Yeah, so one of the things that hasn't yet come up, but you all might be wondering is, well, what has this looked like during the pandemic? You know, how have people been able to access programs? Certainly that popular question of, are these programs near me, you know, becomes, you know, a little bit of an easier question to ask, because you know, during the pandemic, a lot of the ways in which these programs have pivoted have been to offer remote options. So whether offering programs via platforms like Zoom, like the one we're on today, or over the telephone, you know, through a toolkit type of modality. There are a lot of different ways that these programs have adapted. And so even if, like Melissa was mentioning, you're not able to find something geographically close to you, you might still have the opportunity to attend a program in a remote fashion by using technology. You know, technology sometimes can be a blessing and a curse all at once, but it has been something that during a time of, you know, isolation in the pandemic has been quite helpful for making connections. So, you know, that we've seen with these programs has kind of opened up you know, accessibility in terms of, you know, people being able to attend when a program might not be close to them. And then, of course, we've also seen those who may be a bit more homebound, who previously might not have been able to access in-person programs at their local senior center or recreational facility, now able to access programs in a remote fashion. So just wanted to touch on that too, because some of y'all might be wondering, hey, how has this looked during this time?
Good point, Christy.
I do see that we had a couple of questions come in.
Okay, I'm sorry. Did you want to go and did
Oh
you
no,
want to
go ahead, Elia.
Okay, I just saw here from Charlene, have you designed programs for individuals with multiple disabilities like deaf blindness?
So again, I think that sort of speaks to the adaptations that we'll do if that, you know, comes across. So a lot of the programs that we're specifically delivering out in the community, no. But I can only speak for us, or for my organization here in Massachusetts. We work very closely with Independent Living Center, Northeast Independent Living, and they run a lot of evidence-based programming for their population. So, you know, there might be things out there. I mean, Google is wonderful. So if you, you know, you can Google and find there's evidence-based programs for children in school, and, you know, and all age groups and things like that. So my organization specifically does not implement anything that was specifically designed for that population.
Yeah, I think when we're talking about these programs, I think like Melissa has touched on with the multitude of programs, it's really up to the program developer to create those adaptations. But like Kristen also mentioned when she was talking about a matter of balance, is that the class sizes are kept pretty small. So in that way, those of us who are leading classes are able to keep in touch with our participants and get to better understand, what their needs are and adapt. We did talk about that fidelity word, right? The kind of rules of the program, but there are adaptations that we can make that are not, out of bounds. That allow people to better access programs. I can think of, for example, here in California, we have a partner in Ventura County that is working with the ARC of Ventura, and they have a population of individuals, both young and old, that have multiple disabilities, and they're doing a Tai Chi class. And certainly Tai Chi has its different forms, but to different people, those movements might register in different ways. And so it's not out of bounds for somebody to say, lift your arms like Frankenstein, right? And that might give people a certain vision, right? To be able to connect that image with that movement. So just thinking about, just those nuances and finding ways that we might be able to connect with the participants are those ways in which we may be able to adapt in those settings.
And there was another question, but I think Melissa addressed it about Braille formats. How can you find classes as a program student or participant? Are any workbooks available in BRF format where you can download them online? Are they virtual and free? And how can you find programs by state? This person lives in Ohio.
So I'll answer that just for matter of balance. To find classes in Ohio, you definitely would want to visit the NCOA website and look for the Falls Prevention Coalition for Ohio. Or you could contact us here at Matter of Balance, and we would look up for you the folks who we have trained in Ohio. We have a list of our folks that we train all over the country and where they're located. So that would be another way to access the Matter of Balance program in that area. And we do not have hard Braille copies of the participant materials. However, we do provide our materials in a format in which they can be printed off by a Braille press, Braille printing house. And we definitely work with organizations to do that. So it really is, I think, being a program director, we try to follow the need, and when we're contacted by folks because of, we haven't already provided something that's needed, that's where we start to investigate and learn how to create an adaptation or a translation. So a lot of the translations we've created have come from people reaching out to us and saying they, are interested in participating, but they need a certain way to have the materials presented in order for it to be accessible. So we're always learning about as technology changes. I think I just saw something in chat about are the materials available in a web-based format? And I'm like, I don't even know about that, but my guess is because it would then be accessible to a maybe an audio translation service that would kind of play through the computer. So there's so much out there that we don't know about that, we really are willing to learn and try to provide in a format that's relevant and accessible to the people who want to use it. So if it just because it maybe doesn't exist currently doesn't mean that it won't. I can't imagine that it would be I could turn it around super fast, but it's definitely something, that we're willing to work on. So hopefully that helps to answer that question a little bit, at least for the Matter of Balance program.
Okay, I don't see, oh, wait a minute, there is. For people who are blind, do you offer the content in a web browser format rather than large print or perhaps a Word document?
So I think I tried to answer that. The answer is no, but it's not, I think it's possible. I don't know what that would look like or what that means. And so if that's something you're interested in and you wanted to, take a matter of balance class, you would contact the class near you, and we would work with the folks who would administer the program in that area to see if we could make the materials available in a format that would be, accessible to the technology or, you want to utilize to have the participant materials. So I don't think it exists that way at this point, but we'd be willing to help try to make that happen.
Okay, thank you. I think that's the last question I see so far.
I think that one of the previous questions was asking about, how do we access the materials, or can we download them? And to kind of go back to something that Kirsten was talking about a little bit earlier, in order to access the materials, you do have to be trained to facilitate the program. And that's in large part to make sure that the program is offered, within those guidelines, within those fidelity guidelines, and that, Maine Health, as the program developer for a matter of balance, for example, is able to keep track of who's actually implementing the program, right? And have they received the proper training? So that's where the access to materials comes in. For anybody who enrolls in a class as a participant, they do get a participant workbook. And that's where, a lot of the adaptations show up, whether it's in, different font size or Braille, like Melissa was talking about, or even in different languages. That's where the participant handbook comes in terms of, what that looks like for those adaptations. But it's not kind of the full, gamut of resources for the program.
There is a question here. There's a couple that came in. If you want to take those now. How do I prevent falls in my home? And then, is the training online and asynchronous?
I can talk about preventing falls in your own home. And again, this is something that Matter of Balance does. There's a nice exercise and a way to do a home safety assessment. Of course, we all know about scatter rugs. So just being careful if you have rugs that are, a throw rug or a scatter rug, making sure that it's secure down on the ground. There's all types of things to do with taping it and whatnot, and, making sure that there are no lips that could come up. Way back in the day, 17 years ago, I used to be a care manager going into older adults' homes. And so, sometimes I would even see, linoleum kitchen floor maybe coming up in one section. So really just things on the ground, clutter, stacks of books or newspapers or things like that, just making sure there are clear pathways. That also greatly helps EMS if you ever have an emergency and they need to get into you, making sure there are clear paths for, first responders coming in and out with stretchers. I mean, I've been in homes of people that I don't know how they would have gotten somebody out if that ever, if an emergency ever arose. Of course, cords and things, not having cords, all across walking spaces. Adequate lighting, again, making sure there's not a lot of shadows and that you have, again, you can see the pathways are lit. Having night lights and things at night. I know my husband keeps saying to me, why do we have night lights? Our kids are so much older. I'm like, we all need them. It's safe in the middle of the night, or if it's a little dark, to have night lights. So I have night lights everywhere. And there's a lot now that are really energy efficient and, will work on a dimmer. Keeping things that you use frequently within arm's reach. So, if you live with someone and they keep putting your favorite coffee cup up really high and you're finding yourself stepping on something or struggling to get it, make sure you're communicating things like that. So really just making sure that the things you need to access, all the time are within your reach. And, keeping an assistive device near you if you need it. So it's right there and it's not, across the room should you need to get up from a chair or things like that. I also just saw something come in, and I'll just switch gears. How do you prevent falls in a community? And this, of course, is trickier. You could really do some nice adaptations at home with grab bars and things like that. Having bars near the toilet and in the shower, making sure you have the grips in the bottom of the shower so you're not slipping in there, making sure you have a sturdy mat that's not going to move around when you step out of the shower with wet feet. In the community, it's a little more tricky because you're not always going to be really aware of your surroundings and how far that curb goes down, or where there's going to be, a part in the sidewalk that has come loose, or, rocks and things like that. So really it's about, just real being safe. And again, communicating with those people that you're with, not being ashamed to ask for, a hand, or can you tell me what it looks like in front of me right now, and things like that. There's been a great movement the last couple years, states becoming age friendly. And really that means that whatever is good for an older adult or someone with a disability is good for the whole population. If we think about more curb cutouts for wheelchairs, that also helps moms with strollers. Is a city or a town really walkable? That helps everyone get out and get moving, but it's also safe at the same time. I know here in Boston, we've been redoing a lot of sidewalks and thinking about the way that the crossing signals work and things like that. So, but these classes will, do a lot of that education as well. All right. I know I jumped ahead, but I just figured I would talk about both of those at the same time.
No, it's okay. I think one of the other questions was, is the training online and asynchronous?
Yeah, Kirsten, do you want to talk about the training?
Sure. So for the Matter of Balance program, we are doing virtual trainings to adapt ourselves to the COVID-19 pandemic. It's not something we had offered before, but the trainings are synchronous. They are not asynchronous. So we do get people together on a format similar to how we are today, all of us joining from our own devices, and we do provide the training that way. The training is a 20-hour training. We do not require any particular type of background for our master trainers in our Matter Balance program. We developed a lay leader model. So people from all different backgrounds who have an interest in preventing falls and are interested in working with older adults, those are the qualifications for them to come to our training and be certified in the Matter of Balance program. You can find out about those trainings on our website or by contacting myself. We have trainings just about every month, and they will be virtual at least through April of 2022. And beyond that, my guess is we'll go back to an in-person training model, but we'll still also offer the virtual training model, because for some people it works out much better than it would be if they had to travel to do an in-person training. So learning a lot from the pandemic.
And then let's see, there was, can you cover some of the concepts that are covered in the Matter of Balance?
Sure. So I did speak a little bit about that cognitive restructuring, taking those negative thoughts that make, that give into that fear of falling, and maybe cause us to reduce participating in those physical activities that we either enjoy or need to do. I think that negative thinking can increase our being sedentary and will often result in loss of muscle mass, loss of the skills of being able to move around, and increased isolation and depression. So we try to take those negative thoughts and really help to shift over to a more positive way of thinking and solution finding for developing strategies together in that small group format to address people's specific thoughts and fears, and come up with solutions on maybe, well, how would you continue to do that? It might not be the exact same way you did it before, but it might be slightly different, but still just as meaningful, and help you to keep that active life. Other things that we discuss in Matter of Balance, or we do teach some exercises. We do a lot of work on assertiveness and the role that plays in falls prevention. We also look at that home safety checklist, and we talk about how to tackle certain things in our homes that would increase our risk of falling, and what some potential solutions might be for those things. Because it is a small group participation class, the topics that we cover are the same, but whoever's in the class and the concerns and the solutions that are brought up in those classes can be a little different because of the makeup of the folks in the room. We definitely have leaders for our classes, but we also feel as though the participants that come to our classes have just as much information and knowledge and creativity and resources to help solve problems as the leaders of the class do. So we do really try to foster that group participation model. I think I saw a question come up where, is there a cost for the training? There is a cost for the training. We charge $2,000 for that training, and also that includes the license to use the Matter of Balance materials and develop that program at your organization.
You also, through that Falls Coalition list for each of the states, if there are master trainers within that state and you're looking to become a lay, it's called a coach, you may be able to get trained through them as well. So for instance, 2 of my staff are Matter of Balance master trainers, and next week they're holding a training. So they're going to train a group of people here in Massachusetts. And the cost is always different. It depends on funding, if we have some grants, or if we're working with a local foundation, maybe they'll help with some resources. So, local costs may differ. The only thing that's hard is resource-wise. The states usually don't have as many resources, whereas Kirsten, like she said, they have a lot of training scheduled through April. So that's always we're always sending people to their website to check, because you can probably get trained faster that way. And while we're talking about cost, Pris is asking if there's a cost to participants. Again, this is going to differ not only within a state, but just within an organization. We don't charge here in Massachusetts, but we might have partners or folks in our state who are not associated with us, who maybe got trained and are running on their own, and I've heard of people maybe charging like $5, but that is going to differ agency to agency or state to state if there's a cost to participants. If there is, it is very nominal, maybe just to cover the printing of the books or to offset that. Yeah.
And then there was a question about what are the typical professional backgrounds of the Matter of Balance trainers?
Yeah, Kirsten kind of touched on that.
Okay.
Go ahead, Kirsten. Do you have anything to add?
So we developed a lay leader model for our program. So you don't have to have a clinical background to offer that to be. You don't have to have a clinical background to be trained in the Matter of Balance program. Many folks do have a clinical background, but you do not need that. And I think it might be helpful if I talked a little bit about the the organizational structure. So Matter of Balance, we train people all around the country to be master trainers of our program. And what we mean by that is that they are trained in how to implement and supervise the program for their organization. And as a master trainer, they are able to train lay leader coaches to implement the classes. So I think, Melissa, I think you said that, you could become a volunteer lay leader coach within your area. And typically there's no cost to do that, to implement the program for an organization. But there is that cost to become a master trainer. And the master trainer really has much more elevated level of responsibilities to maintain fidelity, to train and supervise lay leader coaches, and to really make sure that the program is being implemented in the way that it's designed, so that people do receive those really great outcomes that we covered during our presentation earlier. So the fee to become a master trainer is a little higher, but then there's no other subsequent fees after that to implement the program at the organization, outside of duplication of participant workbooks, small fees like that.
I do want to add that, Kristen mentioned it is the lay leader model, but a Matter of Balance is not completely void of the healthcare connection. There is what Matter of Balance calls the guest healthcare professional to come and visit the class during one of the sessions to talk to participants about some questions they might have, show them how to safely get down to the floor, or if unfortunately they may have experienced a fall, what to do, how do they get back up from a fall if able, right? Or how to alert for help. And what that healthcare professional does is also encourages the participants to always connect with their healthcare team. What we know about falls is, it can be embarrassing, right? And sometimes people just don't want to talk about it. I don't want to tell my loved ones because they might tell me to move in, or they might move in. And, therein goes that, loss of independence that you all were talking about in the beginning. Or if I tell my doctor, if I tell my nurse, he or she is going to say, I can't do this anymore, right? And, while that might be some of the common thoughts that go through the participants' minds, we also know that, not talking to, friends or family or your healthcare provider about a fall can also contribute to future falls, right? Because we're not addressing what actually caused the fall to begin with. So that's always what we like to encourage with the visit from the healthcare professional as well. And because we have lay leaders, facilitating the programs, we're always encouraging our coaches, hey, don't answer any questions that you're really not qualified to answer, right? Encourage participants to, go back to their doctor, go back to their healthcare team, and check with them, because they're going to be able to provide the best solution for that individual.
Okay, I think there was a couple other a question about what device do you recommend to the wraparound devices, like around the neck, the alerting devices?
I think this is going to be one of those instances where we refer back to the doctor.
Okay.
Everything's going to be, so individualized by person. We do talk about, some of these alerting devices in a Matter of Balance as, something that could be helpful. If you've experienced a fall, that could be a really great way to have something on your body, whether it's around your neck, on your wrist, on a keychain or what have you, that allows you to call for help really easily. But, the best solution is going to be one that's, recommended by your healthcare team. We don't endorse, any specific companies or anything, but we know that those things can be very helpful in alerting for help.
Yeah, some agencies are nationwide, some are just specific to certain areas of the country, and your insurance might cover it. So it really is best to get a list from your doctor or a local organization that has resources like that, because it will just be specific to your area.
Okay, and then there's another question about, is there a pre and post assessment for participants to assess the impact of the program?
Yes.
There is, and we're all, nodding our heads vigorously because we are so heavily steeped, because, these are evidence-based programs, not just, from the initial evidence. We want to make sure that the evidence is showing up as we continue to implement the program. So yes, indeed, there are pre and post assessments for participants to complete, asking, have they experienced a fall? What did they do after they fell? Or how many falls have they experienced? What chronic conditions, if any, might they be managing? What else do we ask?
And that's how Kirsten got her data she shared with you about the percentages of people who were going to continue exercising and who felt more confident, like they could speak to their doctor. Those were kind of the pre and post questions about their confidence and things like that. Sorry, Christy, I cut you off.
No, that's perfect. Actually, that's helping to jog some of my memory, and it asks questions about how vigorously active somebody is, like Melissa mentioned, what people are planning to do after the class is over. So some questions about confidence and actions after the class. Somebody might have said at the beginning of the class, nope, I don't talk to my doctor about this, right? And at the end they said, okay, I'm gonna make it a point to talk to my doctor about that fall that I experienced.
Yeah.
Right. And that's the kind of change that we're looking for, right? Not just the change that might happen over the course of the class, but the change that can be sustained beyond the class, and what behaviors might people be changing so that they can prevent falls going forward.
And then there is a question, Chris wants to know, Melissa and or Christy, have you worked with orientation and mobility instructors in the MOB or other fall prevention programs?
We have partnered with physical therapists before, making referrals, and there was a network of physical therapists here in Massachusetts that they would rotate being that guest healthcare professional, but no, no, we haven't.
Yeah, same here, not specifically mobility instructors. We have found similar things in California where, we have had outlet to physical therapy clinics or physical therapists or occupational therapists who, serve as our guest healthcare professional. And with that hat on, they're able to provide some other recommendations when they come to visit, because that's within their scope of practice, right? They can kind of go beyond what we teach in matter of balance and put that physical therapist hat on, or that occupational therapist hat on. We even have nurses or even, some physicians who come in who bring their knowledge and their expertise that they can share with the class. But beyond that, no, we have not.
I think that was the last question that I see right now. So we'll keep going.
Yeah, if any other questions come in, feel free to throw them into the chat. Of course, we have provided our email contacts. Should anything come up after the fact, you have Kirsten, Melissa, and my email address that you can feel free to reach out to us for any questions, whether it was about training or finding classes or what have you. We'll give another few seconds to see if any other questions come into the chat. Otherwise, Alaya and Pris, shall we go ahead and wrap it up?
I think, well, Pris wanted to open it up to phone questions. So are we taking phone questions?
In the past, Elia, we have tried to do that in case people could only join through the phone and
Oh,
didn't
I
have
see.
access to the chat. That's why one has.
Oh, okay. Let me see if we have anyone who is on the phone. Let's see. All right. We do have a few people who are on the phone, and if they have any questions, they should be able to unmute themselves and ask the questions. We have about 4 people.
Okay. I wasn't sure. I know we have in the past had a few people who needed to do that.
Oh, that's a good idea, because you're right. Some people don't have, because if they're on the phone, they're not going to have access to the chat. So yeah, it makes a lot of sense to be able to do this. So thank you for mentioning that, Chris. And I was able to ask them to unmute if they felt like they wanted to ask a question. But I don't hear, or let me make sure. Nope, I don't see anything. While we're waiting for that, there's there's another question. How does visual acuity affect fall prevention?
Can go ahead and take that. So some of you all, when we asked for feedback in the chat, talked about contrast, and we can think about contrast in print material, but we can also think about contrast in our everyday lives, whether it's the color of the tiles on the floor, or even the glossiness, right, of the tiles or the flooring. Visual acuity, whether you're perhaps a bit more nearsighted or farsighted, some people register with it in that way, can really impact falls in terms of how far ahead you can see in front of you, how aware you are of your surroundings. When we think about vision loss, we also talk about that sometimes in tandem with hearing loss, because when one sense is diminished, another sense gets heightened, right? We do know that. And so for people who might experience losses with multiple senses, that could make it really, really stressful when it comes out to being in the community, trying to prevent falls. I know that I have a family friend who experienced hearing loss, not vision loss, but hearing loss, and being in a loud restaurant was just really, really stressful for him, because he couldn't hear the person, but also had to rely on, his visual acuity to be able to interact with other people, especially in a social setting. But when it comes to visual acuity, especially in the community, can have a big impact on fall prevention, with awareness of surroundings and how they register to you.
And let's see, there's how do you suggest that participants assess themselves or those they serve for fall risk?
So, I actually saw that question come in, and I just went to Google and I got a link that I'm going to put here. So there's a variety of ways. There might be local resources, some of the organizations that we've said to kind of link yourself up with the local falls coalitions. However, the CDC, so the Centers for Disease Control, several years ago came up with a toolkit. It's called the STEADY Toolkit. I don't like the name. It's called Stopping Elderly Accidents, Death, and Injuries. It's a terrible name, but that's what it is. But it was put together for clinicians to have a simple risk screening tool to administer at an annual wellness visit. However, just like the programs we're talking about today, there's no clinical experience required to be able to ask these questions. It's a very simple 12-question tool. And what I love about it, the questions are yes or no answers, and it will ask a question, you answer yes or no, and then there's a column that says, why is this important? So, for instance, one of the questions might say, I have fallen in the last year, yes or no. And we know the research shows us that if you have fallen, your odds of falling again, that percentage goes way up. Things around medications and, having vision checks and using assistive devices, things like that. So again, it's 12 questions, yes or no, and you add up the score and it kind of shows you where you're at, low risk, moderate risk, or very high risk. So that's just one example. That's a really good community tool to use. I know back several years ago, we were trying to sort of come up with an in-home, way to address falls when everything was just being done in the community. We had people with, really bad mobility issues, and just getting in and out of the house it was just a lot for them to even get out to a doctor. So how can we help these people at home? And we looked into a lot of the tools, and so many of them were for hospital and nursing home assessment. Of course, they're always looking at, falls there. So, but I really encourage you to check out the study toolkit. They have it in English and Spanish. They have some nice, posters and brochures and other collaterals that you can use. But we've been using that for several years now. And they also have NCOA that we've talked about several times today. They have also turned that into a digital tool. So it's called the Falls Free Checkup, and you can do that online, and it's the same questions, and you get your score via email, and you get resources and educational materials and things. So you can do it just on paper or do it in that digital format.
Okay, and there was just some comments here just about wearing a face mask affects vision as well. And then the study toolkit is linked to the resource list that we have as well. So that's good information to have. That's great. It looks like I don't see any other questions, and none of the callers seem to have questions right now that I can see. I'm just double checking, making sure that I don't miss anyone. Okay, nope, I haven't missed anyone. Okay, well, I think if we are at about 6 minutes left, so if there's any closing remarks you all want to make, you can do that, and then we will, I'll go through my closing checklist.
I think we just want to say thank you all for having us again today. Fall prevention is something that's so important to us. And, just by being here today, it shows that it's something of importance to you all too. Fall Prevention Awareness Month is really just a time to, share resources, but, we don't have to stop doing that just in September. It's something that, is a very serious issue at all times. And so, that's something that we're dedicated to. We thank you guys for the work that you all do, and, helping to be a bridge, between what we do and what you do, right? And we can continue to learn from each other. Again, thanks to Pris and Alaya for having us here today as well.
Well said, Christy. I echo that. Thank you.
Yes, no, thank you. Oh, let me get myself off of, there we go. Now I can, like, trying to find the video link. So for those of you who are, you hear the voice recording and not recording. Anyway, we want to thank you for sharing this as well, and we look forward to further partnerships and presentations. If there's any other information that you all want to share, I think it's important that we use our platform as well to help you get the word out. So thank you all so much, and thank you everybody for attending, and we look forward to seeing you at our next webinar. Thanks so much, everyone. Have a good evening.
Thanks, y'all.
Thank you.
You're welcome.